One of the prime problems with patients who have irregular jaws and teeth is that their upper jaw is very narrow. And treatment to widen, or they say expand, the upper jaw have existed since the 1800s. And there have been many ways of achieving this, most of them using a small screw which is turned regularly and widens the top jaw physically. People use various different types of appliances in order to achieve this. One of the most popular has been the Haas Appliance, created by Andrew Haas. And this was very effective in correcting minor irregularities of the jaw, although most people do not recommend it for widening more than about 4 millimeters. This may assist in gaining straight teeth, but does not normally provide enough room for the tongue. A large range of appliances were produced by an orthodontist called Swartz, and he designed various versions which would enlarge the upper jaw as well as lengthening it. However, this also worked relatively slowly, and although it moved the teeth, had little effect on the jaw as a whole. From around 1912, appliances have been used which open the upper jaw rapidly, turning the screw more quickly, about 3 or even 4 millimeters a week. This forces the two halves of the jaw apart and will widen the upper jaw physically quite quickly. However, it does have some advantages, basically because it is rather traumatic and causes damage to the teeth, which occasionally results in their loss. It also creates a lot of pain, but has remained popular with many orthodontists who wish to get a rapid result. Back in the early 60s, I created an alternate method of opening at a semi-rapid rate. That is quite strictly at 1 millimeter per week, and lies between the traditional opening rate of the Swartz Appliance and the Haas Appliance and the rapid appliances which are used by many orthodontists now. My research quite clearly showed that this is a good physiological rate. In fact, many people feel the ideal physiological rate. It causes virtually no discomfort and, in effect, no damage to the teeth either. But because it is such a gentle force, it is slower, but it can continue much longer. And I often recommend opening the upper jaw 10 or sometimes 15 millimeters, which is far, far wider than any of the alternate methods. This has the big advantage of providing room for the tongue. And as you know, I believe that it is necessary for the tongue to rest in the palate if the final result of correcting irregular teeth is to be stable.